Tetanus is a bacterial infection that is caused by the bacteria Clostridium tetani, commonly found in animal manure, animal bites, or contaminated soil. It enters the body through cuts in the skin and via puncture wound. Once inside the body, the bacteria multiply rapidly, releasing tetanospasmin. This enters the bloodstream and spreads throughout the body, which affects neurosignals traveling from the brain to the peripheral nervous system. This leads to muscle spasm and dysfunction, especially in the neck and jaw. The symptoms of tetanus include painful muscle fits, locked jaw, swallowing problems, breathing problems, heart attacks, fever, blood pressure fluctuations, and pneumonia. A doctor can diagnose it by examining recent cuts that have been in contact with soil or checking for symptoms of neck and jaw stiffness and trouble swallowing. Treatment for tetanus is conducted in a hospital. It includes wound care, antibiotics, tetanus antitoxin, and medicines to stop the seizures. These symptoms will usually show between 3 to 21 days after contracting the infection. Tetanus can affect anyone and isn't solely targeted at one demographic. It's rare in Australia as most people are immunized. Populations at risk include people who have never been immunized to tetanus and people who haven't had a booster immunization in the past 10 years. If you do have tetanus, your doctor may be required to notify the state health department. There have been fewer than 2 tetanus hospital admissions per million population each year since 1994. The number of deaths has fallen significantly since tetanus vaccination was introduced for children in the early 1950s. Vast majority of death cases in the past 30 years were people aged 65 years and older who may have not been vaccinated recently or at all. The disease is preventable by tetanus immunoglobulin VF. Its active ingredient is tetanus immunoglobulin for intramuscular use. The product is prepared from voluntary donors. It contains protein substances known as antibodies, which can provide protection against tetanus infection. It contains 160 mg per milliliter blood proteins, of which at least 98% are immunoglobulins, and another 22.5 mg per milliliter glycine. Donations are selected on basis that they contain high levels of antibodies against the poison produced by the bacteria. As it is manufactured from human plasma, it must be collected by the Australian Red Cross Blood Service. It is used for the prevention of tetanus in a person who has not been recently immunized against tetanus or who suffered an injury which could possibly expose them to the bacteria. It needs to be stored between 2 to 8 degrees Celsius, protected from direct sunlight, and it must not be frozen. When injectable products are made from human blood, it is possible that viruses and other substances could be present and cause illness. These could be viruses such as hepatitis, human immunodeficiency virus, and theoretically the Creutzfeldt-Jakob disease agent. There could also be other infectious agents, some of which may not yet have been discovered. To reduce the risk of this happening, extra steps are taken when manufacturing this product. Strict controls are applied when selecting blood donors and donations. The product is specially treated to remove and kill certain viruses. These special treatments are considered effective against viruses known as enveloped viruses, such as HIV, hepatitis B, and hepatitis C viruses, and non-enveloped viruses such as hepatitis A virus and human parvovirus B19. Despite these measures, the risk of viral and other agents' infectivity cannot be totally eliminated. Before being administered with tetanus IVF, the patient must inform the doctor of any allergies or if they're taking other medication, have previous tetanus vaccine injections, have a known IgA deficiency, blood disorder, or clotting issues. Pregnant or lactating women should also discuss the use of tetanus IVF with their doctor. Reactions after infection with tetanus IVF are uncommon. However, some pain, redness, and stiffness is apparent in the injection site, which are common after large intramuscular injections. Occasionally, mild fever, chills, drowsiness, or discomfort may be felt and an itchy rash could develop. Tetanus IVF can sometimes interfere with live vaccines such as measles and polio, even up to 3 months after their respective administration. This should be discussed with your doctor. Now you may be thinking, how do I know that tetanus IVF is a safe treatment option for me if I were ever to contract tetanus? Well, there are so many different legislative bodies in Australia that regulate and monitor the production and administration of these products, along with other therapeutic products that are sourced from donor blood products too. The legislative bodies responsible for the ethical and legal production of tetanus immunoglobulin VF are NATA, NBA, TGA, and the Human Tissue Act. NATA is the National Association of Testing Authorities and is currently the sole provider of accreditation of medical pathology laboratories and acts as the inspection agency on behalf of Medicare. NBA is the National Blood Authority, established in 2003, and it is a statutory agency that manages and coordinates arrangements and services on behalf of the Australian Government. TGA is the Therapeutic Goods Administration and is responsible for managing therapeutic goods like prescriptions and blood products. The Therapeutics Goods Act 1989 helps to regulate the safety, efficiency, and quality of the blood products obtained. Tetanus immunoglobulin VF is categorized as medicine by the TGA. TGA deems the production of tetanus IVF as a medium risk product and requires it to contend with a good manufacturing practice. This includes on site inspections of manufacturers and compliance verifications, and safe and sterile production of goods according to the specifications of the GMP. The National Blood Agreement is where the Commonwealth, the states, and territories agree on the national approach of the management of the Australian blood sector. The NBA coordinates the collection, production, and distribution of the blood products to be used for human therapeutics and diagnosis under the National Blood Authority Act 2003. They ensure the safety, quality, contingency measures, and reduce risks of the blood supply going out, as it provides the funding for the supply services, as well as manage the distribution of blood products across the states and territories to ensure optimum access around the country. The Human Tissue Act plays an important role for the morals and ethics of society and is enacted in all Australian jurisdictions. It ensures for the consensual donation of blood, tissue, and organs for transplantation and for scientific, therapeutic, or medical purposes. It requires a consensual donation of blood that later can be potentially used in the production of tetanus. It focuses on the rights of individuals to control the collection, use, and disclosure of their genetic information. The inquiry considers that, in order to protect genetic privacy effectively, both samples and information must be adequately regulated. A uniform approach to the regulation of samples and information is preferable to avoid complexity, inconsistency, and further fragmentation of privacy laws. NATA plays the role in providing independent assurance of technical competence and integrity of organizations offering testing, inspection, and calibration services. During the manufacturing of tetanus immunoglobulin VF, it will monitor the manufacturing equipment and the techniques of the methods implemented by research scientists. NATA accreditation is formal recognition that facilities produce reliable technical results, which increases community confidence and trust in a facility's services, mitigates risk, improves tendering success that may be encountered during the production of the vaccine. Hence, NATA plays a significant role in the standardized production of tetanus immunoglobulin VF. The clinical workforce accurately records a patient's blood and blood product transfusion history and indications for use of blood and blood products that could potentially be used in vaccine production. Health service organizations have systems in place to receive, store, transport, and monitor wastage of blood and blood products safely and efficiently. Patients and carers are informed about the risks and benefits of using blood and blood products, and the available alternatives when a plan for treatment is developed.